Hi there, and welcome once again to the Death and Sex Podcast. My name is Stephen Thomas, and with me always is Dr. Kailey Bradley. Say hello, Dr. Bradley.
Good morning, everybody.
No, you did it again. You're supposed to say, hi, Dr. Bradley.
Oh, sorry, I missed the joke.
Again. We'll get it. We'll get it one time. And then today we have a special guest. We have a special guest with us, Reverend Dr. Bethany Fulton. Say hello, Dr. Fulton.
Hello, Dr. Fulton.
Yeah, she got it.
She did it. She did it.
So thanks for joining us today. Is it okay if I just call you Bethany for the rest
Please
of our
do.
conversation? Okay,
Yes.
Thank you. So tell us a little bit about you, Bethany, and your who you are, what you do, all that fun stuff.
That's a really broad thing. Okay. Hi, I'm Bethany. I am a counselor in Ohio, and I have been counseling since 2009. And I recently started working for this fantastic place called Refuge Counseling. So,
Woo!
yay. And prior to that, I've done work with churches, schools, community groups, kind of all over the place. My focus is on helping people who are living with depression and anxiety and mood disorders. And like every good counselor, there's a great story behind that and a reason why. And a lot of those reasons, we come to this profession because we seek understanding, but also because we find some healing in helping others. So that's where I am.
We're so glad to have you both here at Refuge and here on the podcast. And I love how you said, I think we do. We come to this profession to seek understanding. I really like that.
Mm-hmm.
So,
Yeah, absolutely. So go ahead.
I was really excited about Refuge because of the components of grief. And one of the things that I really like is that on one of the very first things that you see on our webpage is it says that it's a place for difficult conversations. Mm-hmm. And I love that that is a priority because we need spaces like that more than ever. And I don't think that people recognize the safety and comfort that can be found and the healing that can be found by verbalizing what hurts us, what wounds us, what scares us, and that we can do that and learn how to verbalize and engage with what brings us hope and joy and create that balance. So that's a big part of what I really loved about my introduction to the two of you was this willingness to be in that space of equanimity. 25-cent word, I think.
that was
more than a 25-cent word.
I love it. It's an SAT word.
Yeah.
You know?
Yeah,
thanks.
It was
that means a lot.
very, very unbalanced. Strong on the English, very low on the math.
I don't do numbers either. I say, bring me the feelings, bring me the emotions, but man, numbers are scary. Super
True
scary.
story.
They are.
I failed statistics in college because I thought to myself, I will never need this. I had to retake it, passed by the skin of my teeth. I don't know why I'll need this. Got out of college, decided a year or two later, I think I'll do mental health counseling. And what course did I have to take at a graduate level? Statistics.
Statistics.
Mm-hmm.
Oh, man.
Well, I love what you said, Bethany, about difficult conversations. And one of the things that we kind of wanted to talk about a little today is the concept of trauma and trauma-informed counseling and what that kind of looks like to each of us. So I know that's another kind of broad question, but maybe just throwing out this question, guys, in terms of how do you all define trauma?
That's the place to start, right?
Mm-hmm.
Sometimes, most often, we have people that come in and they don't know what trauma is. They know they have it.
Yeah.
but how do you define it? And
Yeah.
in some ways that matters. And in some ways it's enough to say, hey, you're in the chair. You're here. You took that really big step forward. And that's what matters.
Mm-hmm.
I think pulling people into the present moment with trauma is really important, so that we have a sense of perspective and a sense of mindfulness built into our stress reduction work and our maintenance development. You know, how do we keep people in the present moment and not re-traumatizing while working through whatever has brought them into space with me, and being able to say, that you can have trauma in your life and still be healthy and happy and functioning and find joy. That we often have, well, we do have more than one emotion existing at a time, right? So often there's a primary, a secondary, a tertiary at the very least. Mm-hmm. And then when we can identify what those are, then we can start to unravel that a little bit and rework it into something that is supportive and encouraging and safe.
I love that.
Yeah, I do too. How do you define trauma, Stephen?
Well, I'll answer that question, but I want to follow up on something that Bethany said. You know, Bethany, you said that people will come in and they can't define it, but they'll know they'll have it. I'm curious for either one of you. So another question on top of the one Kailey just asked me. I'll often find that people will come in and will minimize their experiences. Oh, that's not trauma. And is that something that you both experience? Because when we talk about, you know, how do we define trauma, I think it's very hard for people to wrap their heads around what happened to me, because it doesn't feel as severe or it's not as big. And I like to use the analogy, well, whether it's big T trauma or little t trauma, trauma is trauma, and the impacts are often the same. Maybe differences in terms of like how significant the impact. Maybe we're not having visceral flashbacks, but still like it's impactful. But yeah, can you like to hear your guys' thoughts on that?
Yeah, I would say, you know, there's a lot of clients that may say things like, well, this person over here had it a lot worse than me. Maybe I shouldn't complain, or maybe,
Right.
you know, it's not a big deal. I wasn't like I was, you know, X, Y, or Z. And so there's, I think, a comparativeness that comes online. But I think you're so right, Stephen, that, you know, the individual that's in a counseling session with us is the one that gets to define, right, trauma and what that looks like for them and how that manifests. And I think it manifests itself so differently with every person too, right? But yeah, absolutely. I think we all have a tendency to kind of minimize our own experiences.
Bethany, you were snapping your fingers over there. What were you?
Kailey's got some wisdom over here.
Oh, you're very sweet.
I really like that. I think the idea of, well, all of us use the word minimize. And as a CBT-based therapist, cognitive behavioral therapy, that's a cognitive distortion, right?
See, now I'm snapping because you're speaking my language. Yeah. Full disclosure, Kailey hates CBT.
Oh, I love it with a passion. Look how really
Yeah, I knew I liked Bethany.
we're balancing each other out.
That's
there we
right.
go. I like it. I will take all those CBT people, and you can gestalt your hearts of 10. So, there we go.
Oh, I like that.
Did I just call you out a little?
No, well, you know, I like to say I am a person-centered girl through and through. You know, I am a humanistic counselor by, man, just, yeah.
No, Carl Rogers, the ghost, is leaning in for a hug right now.
He is, for
You're
sure.
appreciated, you're wanted, and you're needed, Kailey.
Yeah. We will definitely have to do some social media reels, maybe kind of to get into some of these, modalities. But no,
Absolutely. I think we should reenact the Gloria tapes.
oh,
There we go.
yes. And for listeners in counseling programs, there are these videos that we watch called the Gloria tapes, and she is a client kind of experiencing these different modalities, and there's something, aren't they? There's
I haven't thought about those in forever, and you said it, I'm like, oh, Gloria tapes.
It was a flashback, right?
Mm-hmm.
Okay, I'll be good. I'll bring us back around.
I love it.
Cognitive behavioral therapy and acknowledging that minimization is cognitive distortion that we engage in because it creates safety. And I think that when people come into counseling, they're in contemplation stages, right? So DiClemente and Francesca in their stages of change, we're looking at people who are on the verge or are willing to take the step through the door because they have an innate awareness that something could be different. They may not be willing to say it will be better or that it's going to be perfect, but they're willing to say, okay, this can be different. What can I do about that? So they're reaching for a sense of change while at the same time going, but it's not a big deal. And I think that space where, fine, it doesn't have to be a big deal, but it's a deal. And you're here. So why not enjoy the comfy chairs that I've worked so hard to get into this office and spend a few moments. I think the other thing too is the amount of time that people think goes into a counseling session. There's so much contemplation and action that takes place outside of the therapeutic office. And it's very easy for us to talk ourselves out of things. It's very easy for us to then go back and go, well, that was just for that moment. I'm fine now.
Yeah.
You look very deep in thought, Stephen.
No. I'm just processing everything that Bethany said there. But I do, back to that question, like, how do we define trauma? I think because clients are so quick to minimize it, the definition is often this big, scary thing. Only these terrible things that can happen to me. And so, I define trauma as when, and please give me your feedback, both of you, but I define trauma as when we're powerless. Because trauma can only happen when there's a power differential. When we don't have the ability to maybe change or stop what's happening. And again, this is where I kind of form some thoughts in my head, and I don't necessarily have the research or the evidence to back it up. So very much more of a personal opinion, but that's where I often see and can understand why people who experience trauma are often very quick to blame themselves. I think we often are looking for a scapegoat or for a reason or an explanation, and it's really scary to say that this stuff happened and I was powerless. So it must have been something that I did. And so I have to then redirect that back onto myself. And I was just thinking about that in coordination and context of what you were kind of sharing there, Bethany.
Yeah.
I think, can we claim that as a working definition? Because I think that is really well said, Stephen.
There is. I think there's a sense of powerlessness, or, I often think too, it's like my ability to cope is less than what has happened, right? It's just overwhelmed my system. It's overwhelmed my ability to feel a sense of any kind of autonomy or power, to piggyback off of what you said, Stephen, which is why so much of trauma work is kind of that empowering process, giving clients the tools to make steps themselves. I think that's what's also so hard in working with trauma, is sometimes we want so badly to get clients to a healthier spot, or we can kind of see that.
Yeah.
And it's really, I think, sometimes unintentionally harmful, though, if we kind of just swoop in and say, like, oh, well, you need to do this, you need to do that, because that also takes away their power, right? And what we're trying to do with with clients navigating trauma is to kind of give them power back.
Yeah.
I don't know if my rambling made sense there, but I think it's, yeah, that empowerment piece is so key.
Yeah.
I think it makes sense. It sounds like moving from being aware that one of the larger concerns within addressing trauma can be for the counselor to hold themselves accountable in remaining in the counseling space and not in the advice giving space, because we want things to shift so quickly.
Yeah.
You know, when we use those absolute words, like what you need to do, what you have to do, what you should do, when we hear those triggers, that goes into the all or nothing realm. And trauma is very rarely, if ever, all or nothing. It's this and this and this and this and this.
Yeah.
I think it's so good for you to say that, Dr. Bethany, that, counseling isn't about advice giving, I think, and that's sometimes really hard for clients too. They'll
It's hard for
say,
all of us.
it's hard for all, yes, it is. I've had so many clients though, like, oh gosh, Kailey, just tell me what to do. You guys had that experience?
Yeah. And what do you say back, Dr. Kailey?
Oh man. That's where I'm like, I need an adult. No, I'm just kidding. But I do try to kind of explain again, what is my role? And yeah, I can give you a clear, do this, do that. But ultimately that has to come from you as the client, right? And I really want you to have that internal sense of, I can figure this out. I can do this. I don't need to be looking everywhere else for advice. What does it look like to really lean in and trust my core self?
Well, now you're getting a little bit hard stuff.
I am getting into. Do you see how I did that?
Yeah. And some IFS, internal family systems. So, yeah, very sneaky. Before we get there, though, we should definitely talk about that. I think it might be helpful to talk a little bit about the differences between, maybe like acute, chronic, and complex trauma. Just to kind of give us a broader definition that, trauma can take on that many different forms. Before we get to that good old treatment approach and IFS stuff. But, real quick, complex trauma is trauma that happens in childhood. And Kailey, help me out with this definition if I get it wrong, but the way that I've kind of understood it is complex trauma it's trauma that happens in childhood, and we kind of live in it, we grow up in it, or maybe it's like something that happens for a period of time and then stops, but because it impacts our ability, it impacts our development as human beings, it then stays with us and becomes more complex as we become adults, because navigating that impacts a number of different ways of that we interact with people. Bethany's got her hand raised. She wants to say something here.
I love that.
You can tell me to shut up at any point, Bethany, and interrupt me. You don't have to raise your hand here.
I'm going to wait for my first paycheck to do that.
That's good. I like that though.
So I just wanted to add that with complex trauma and the fact that a lot of an argument in the field is that complex may not even exist. I believe it does.
Okay.
So I just put that out there. I am an absolute supporter when someone comes to me and says I have multiple things. Complex trauma, as a definition for that from my perspective, is a trauma has occurred, and before the client has the chance to resolve or work through that trauma, another trauma occurs. And another trauma occurs. And they're layered without the opportunity for resolution or healing in any of those trauma experiences.
So in that definition, that's trauma that the way that you're describing it, that's not even necessarily trauma that can happen in childhood, because that's something that can happen as an adult. It's
throughout life.
So that concept or that traditional, I don't know if I call it traditional. I'm thinking of Pete Walker's book, Complex PTSD. and maybe he does describe it this way, but I'm very much thinking, especially his 13 steps for managing emotional flashbacks, which we can talk about.
Look,
She's got it.
She's
So does
got
he
the
talk about?
workbook.
So does he talk about that in there? That it's not just complex trauma, isn't just something that happens in childhood. And the reason I ask is because when I think about his 13 steps, he's often referring to trauma that happened in childhood when we're talking about those managing emotional
I think
flashbacks.
complex PTSD and developmental trauma are sometimes kind of used interchangeably. And I think, yeah, Bethany, you're so right that there is, there's not an actual official diagnostic category of complex PTSD, which
Yes.
my bias is that there should be, because, I think it is. It's trauma that is cumulative, as Bethany's saying. It can also be, one of our counselors, Emily, works a lot with trauma as well, and she talks about what if trauma is your baseline?
Yeah.
What if the environment that you're swimming in is trauma saturated, and that definitely is a very different experience. And it's not to minimize, acute trauma by any means, but they are, I think, nuanced experiences. And I think, complex trauma, there's also the question too, right, of, isn't all trauma complex? I might make the argument, and I think that's similar with, when we talk about complicated grief. Well, isn't all grief complicated? Yeah, so
Some is maybe more straightforward than others. Or more hi, welcome to the state of obvious.
yeah. No, I think, this is the question of language and how do we define these things, I think, again, is really helpful. But also, I think even letting our clients define that too is super helpful. Again, they may say, oh, that's not trauma. And we're sitting there thinking, it is, and just kind of gently allowing some of that psychoeducation and language to emerge, I think, is really helpful for clients.
Absolutely. The baseline of creating space for the client to express their own definition, even if it is not aligned with what we are more aware of, because as an outsider, with a different perspective and different emotional intelligence levels or knowledge access, being able to say, this is a safe space, and in this space you are heard, you are respected, you are valued. What is your understanding of what's going on? And it may be the first time that they've been asked to verbalize that, to say out loud, this is my experience. And even if we go, no, it's way worse, or that's not it at all, the autonomy to express for self and claim that space, I think, is even more empowering than saying, okay, this is the correct definition and this is the historical stance and background. It's how do we bring all those ingredients together?
Yeah. So just to recap, we have the complex, we have developmental trauma, and then chronic and acute. Anyone want to take on what those two things are for our listeners?
Can I use the example of The Pit, my favorite TV show right now?
No, you cannot use that example. Yes, you can use that example. We love The Pit over here. We love The Pit at Refuge Counseling.
We do. If you haven't watched The Pit, it is an incredible show. We need to do a whole episode just on The Pit. Yeah, but it's about a doctor, and he's an ER doctor. It's actually played by Noah Weil, who was in ER.
And the librarians.
Yeah. When I think about, acute trauma, his character, Dr. Robbie, loses his mentor to COVID-19. And that traumatic loss is kind of an acute trauma. But Dr. Robbie is also exposed to chronic trauma in terms of the burnout he's experiencing in his work, the lingering kind of vicarious trauma of caring for, for clients and patients, that's a whole other type of trauma that, we could talk about as well, vicarious trauma. And when we carry, our clients' experiences and don't have, capacity or outlets rather to kind of discharge some of that. I think, again, acute and chronic, they can be so intertwined, right? Because there is often these ricocheting losses and experiences that occur after an acute trauma as well, right? So I think Dr. Robbie in the pit is, exposed to both, unfortunately. So I don't know if that's a great example, Stephen, but that's just one that popped into into my head.
No, I like it. That's great. That's great.
Yeah.
And I think that's just helpful too, first of all, because it's the pit, it's awesome, but also just for people to kind of have an understanding. Oh yeah, trauma can, because I think the thing we want to communicate here is trauma looks different. It can be acute, it can be chronic, it can be ongoing, it can be complex, it can be developmental. It's just, trauma is just so much than just this terrible thing that happens to somebody else. It can be all of these things and more. One other question I have for us that I think would be important to talk about is, how does trauma show up in the body, in the nervous system? And there's a really great book here, The Body Keeps the Score by Dr. Van der Kolk, where he talks about this idea that trauma is stored in the body. Anybody want to follow up on that one? I can talk about that. I love talking about
Jump in, yeah.
Trauma
Go
in the
ahead,
body.
Stephen.
I don't want to dominate the conversation here, especially with Bethany, because Bethany, I think, has a wealth of knowledge in this area, more than we do. But well, how about this? I'll talk, Bethany, and you can interrupt me. You can practice interrupting me and telling me what I got wrong. Okay. So
I'm so down with that. Okay.
yeah. All right. Okay. Great.
All right. Cishead. Let's go.
Yeah. You can mansplain to me. She-splain. Okay, so
I like
Dr.
that.
Van der Kolk talks about how trauma is stored in the body. And the example that I have used and I like is, so if you have let's say you have a child that whenever they're visiting grandma and grandpa's house, abuse occurs. Whether that's emotional abuse, physical abuse, or something else. And usually trauma, when that trauma occurs, it's near the kitchen or in the kitchen while grandma is making pancakes. That kid gets out of that unhealthy environment, grows up, becomes a thriving adult. They go out to breakfast one day with friends, and somebody orders pancakes. And when pancakes comes to the table, the smell of the pancakes hits them, and before they even realize it, they have a panic attack because the body remembers, oh, I'm about to get hurt. And so they go into this fight or flight mode of just, got to get out of here, or got to fight my way out of here so that I don't get hurt again. And so in that idea of like, our body remembers what happens to us, and often we don't understand, why am I responding to things the way that I am? She explained to me.
If you demand it, then I don't think it's she-splaining.
Okay, all right.
Oh, it's a really good point.
Touche.
Dance, monkey, dance.
Dance, monkey, dance.
So, for me, I think that the connection between body and brain, the value of the biopsychosocial connections, we're all intertwined, and I think that it's a fantastic advancement for psychology and psychotherapy in the United States to grow a closer awareness of how these systems interact with each other, as evidenced by the emergence of vagal nerve theory, which is brilliant, as evidenced by things that, books that pop up like somatic disorders, or, change your body, change your life, those kinds of things where we want to distill it down to A equals B. And that's as deep as I'm going to go with the math. But the action of body remembering and body carrying in terms of safety. It comes back to, am I safe? so many things connect with fulfilling our hierarchy of needs. And when those needs are met, then we move to the why and the how and how do I stop it. I like intertwining the elements from Body Cube Score with elements from the work done by John Kabat-Zinn with the mindfulness-based
Mindfulness
stress
stuff,
reduction.
yeah. Mm-hmm.
Because, and Kristen Neff and Chris Garner, like fangirling a little bit there.
Self-compassion all the way.
Oh my gosh, yes. So being able to identify that when we're talking about body-centered trauma, that we're also connecting to the fact that that is most likely not a current experience, but a past experience. So we're reliving, we're connecting, we're recalling, and that isn't always accurate. Every time we have a memory recall, it's like looking at a specific pixel. And then we recall again and we see a different pixel. It always, let me rewind. It often appears to be in that recollection that it becomes more and more personal. So even if the memory is the child in the kitchen with the grandmother making pancakes and there may be yelling or physical abuse occurring, when it's remembered, the details that are remembered and the experience that's remembered shifts a little each time. So it's until it's distilled to pancakes equal pain, which sounds like a really bad punk song, but
Pancakes equal pain.
not where I was.
It does.
Sorry, that's an unintentional soundbite.
Yeah.
No, yeah.
I love it. Oh, I love what you're saying though. And I think this conversation about how our bodies, store trauma and, I also think about, Bethany, you said the biopsychosocial and I also think too, trauma impacts our sense of like our spirituality. Is the world a safe and good place? Is my conceptualization of any sort of higher power, is that person or entity or whatever, however we want to define it, like, is it good? Is it benevolent, right? And when we experience trauma, one of my favorite theories is called shattered assumptions theory. And it's this idea that we all kind of walk around with these certain beliefs about the world and how it operates. And when we experience trauma or we experience grief, those assumptions just completely go out the window, right? And we have to kind of reintegrate and find meaning in other ways. And so, I just think trauma impacts every piece and part of who we are, whether that's our bodies
or...
or...
that applies to the biopsychosocial, because then what you're speaking to is how do we integrate, when we shatter, how do we come back together in a way that is healthier for us? Not being afraid of the sharp edges, or recognizing that those edges can be tempered, or that, is it Nietzsche? That's how the light gets in?
Yeah, absolutely. And I think it's about, when we also, I think, have an understanding that sometimes our behaviors or our thoughts and emotions were there to protect us, right? When we experience trauma, behaviors, communication. And so then that's where we can enter in that self-compassion. If I understand that this was serving a purpose at one point, right, then I can be gentle towards myself and offer, that grace. And then again, we can move forward and again, start to reintegrate. But yeah.
Kailey, what you're talking about is finding meaning in our suffering.
It's all of, yes. Yeah, it is. And again, I think, my role in grief work and, I never want to as a counselor come across as, again, you should do this or you shouldn't do that. You have to find meaning, because that just feels really gross. And that just feels like toxic positivity, which I think I have an allergy to be quite frank. Like, I just literally have a visceral reaction when people say things like, everything happens for a reason.
Yes.
Really? I was talking to a client the other day, and she was processing the loss of a young child. And somebody said, well, they're in a better place now. And we're both like, no, they're not.
That's an automatic response. That is just it. That is meant to self-soothe. That's not offering support or encouragement or even understanding or compassion. That is, I need to get out of this awkward conversation as soon as possible. What did Hallmark tell me? Boom, done, out.
Yeah. And so I always tell my grief counseling students that, like, meaning is an inside-outside process, right? Like, it's something that has to organically emerge in a counseling, setting or whatever type of setting, however an individual might be processing trauma or loss, but it can't come from the outside in. Because, again, that just ends up feeling really icky if we're just kind of mandating meaning. We're just a compassionate companion alongside that process, in my opinion. I could go on and on about the myriad of ways we do that as well. I'm a big expressive arts person, and I think, we make a lot of meaning in art, right? And
Absolutely.
And how we create. Kids do it through play. Kids find meaning through play. They play it out.
So before we run out of time, let's talk real quick about treatments, because I think what you were talking about, Kailey, meaning making, maybe even, kind of tying that into some of the treatment approaches. So meaning making, DBT, internal family systems, go.
Counseling Theories 101 in 30 seconds. No. Well, I think it's important too, like, I always say to my counseling supervisees that, like, it matters less what intervention you use than being that compassionate presence when somebody is navigating trauma. Again, I'm very person-centered, meaning everybody's going to respond probably to something a little bit different, right? And so, what's most important is establishing that safety and rapport with a client. The relationship is what matters, I think.
So person-centered.
I told you, I am through and through.
Yeah, she is.
DBT would take the approach of, dialectical, that two things can be true at once. So you can be scared and safe. You can be a person who has experienced trauma and a person who has experienced great joy. Or whatever the opposite of trauma would be for you. I don't want to throw that in anybody's face. Cognitive, we're going to go through, all right, what was the thought? What's the feeling? What's the action? Which is why I love it so much. I think there's also the elements of mindfulness that, the present moment matters. It is what it is. What do we do with this once we know that there's no turning back or changing it? How do we integrate and accept? And I think that more than anything, the baby therapist would come out with all of these and would have the ACT deck of cards and would have house tree person drawings and all of these different elements. I would make a playlist on Spotify with somebody. But the other element of it is that the more you learn and the more that you practice, I think the more that you understand that really what is valued is offering safe space.
Well, I think that goes to that idea that, there's definitely various research that says, one approach might be more helpful than the other when it comes to navigating trauma. But at the end of the day, and we were just talking about this in our supervision the other night with our counselors, group supervision, the most important piece, I think, out of anything when you're working with a client is that rapport. And if you can have that rapport and you can create that safe space for your client, that's so key in any sort of, whether it's trauma or something else, that's so key in being able to help anybody navigate what they're dealing with. And when we talk about trauma, again, trauma is someone that's powerless. When we're powerless, we don't feel safe. When we can re-empower, when we can give someone that safe just through the rapport, the therapeutic relationship, like it makes such a big difference. Yeah.
I think pulling into I would add in pulling into the present moment.
Mm-hmm. Yes.
To me, I think that's a core element. And then also recognizing that the value of these different modalities is because as counselors, we have to have something to put on insurance. And that's a whole
other
thing.
combo, isn't it? Yeah.
Yeah, I just blew that open and I'm
I love
slamming
it.
shut.
I love it. No, I think
But it
too.
is something to keep in mind, right?
It
Because there's no code for rapport.
Yeah.
There's no code
Right.
there's no line for gently held space while client cried.
Yeah,
You get really, really creative
we do.
with how we can approach something, and then how do we justify? Because we want evidence base,
Yeah.
and we want progress.
Yeah.
But we also don't want to push because we don't want to wound further.
So much to unpack there. Such good stuff. We need to definitely have another conversation. I love. There's no code for rapport. And I think that speaks to the sometimes limitations of our managed care system, right? Efficiency
I think it sounds like a
doesn't,
t-shirt.
right? I'm just thinking that does sound like a t-shirt because, gosh, not everything that is effective is efficient.
Yeah, get your refuge merch right here.
We can definitely create some shirts for sure if you guys want to. We can,
love
Princess. Anyone who tells you different is lying.
I love all of this. Oh,
Yeah.
such good
Thank
stuff.
you so much for the opportunity to come in today and to share this space with you and
Thanks for being with us.
to have the opportunity to learn and just be present alongside both of you is a huge gift.
well, same.
I feel the same way, and let's have more conversation.
Yeah,
Let's
absolutely.
definitely have more conversations.
Let's work.
Yeah, let's definitely, Bethany, please, let's have more podcast conversations for sure. And conversations outside of here as well.
And if you insist.
So thanks for joining us today. I was going to say, if you need anything, I'm in the headspace of I was working with a client. If you need anything, this is how you could, don't forget to message me through our patient portal. Don't forget, that's where my brain automatically went.
I'll send you the link.
Right?
Look out for your homework in your email.
Exactly.
We talked about these 3 things. What's your takeaway?
What's your takeaway?
Hey, one of the things that we always do when we wrap up, Bethany, is we ask ourselves, what are we reading, watching, or playing? So, real quick, are you reading anything? Are you watching anything? Are you playing anything? I don't know if you're a gamer or not. I'm a gamer over here. So.
Are you really? Okay, so I'm exploring ESO. So I am this just shares so much about somebody. This is a little embarrassing, but I'll do it. Okay, so I am at level 17 and I am playing Elder Scrolls Online.
Oh,
And
boy.
I am an orc warrior.
Oh, I love that.
Yeah.
Oh,
Are you, so you're playing Elder Scrolls Online. Have you played any of the other Elder Scroll games like Skyrim?
Oh, come on. I lived in Skyrim for 2 years.
Do you ever
Love it.
stop living in
Love it.
Skyrim? I feel like it's the kind of place you
No.
just keep going back to.
Yeah.
I replayed it recently, not that long ago, because did you play, all right, side tangent, did you play the Oblivion remaster that just came out?
I did. I have not yet. I have plans. But there's this weird thing called work that keeps getting in the way.
I know.
And I'm listening to Rose Betts, Betts, huge shout out, brilliant musician. Gorgeous, gorgeous songs. Kailey, some that you, I'll share with you because
Please do.
they're specifically about death and gentleness and loving self in spaces of pain. And she's just got a gorgeous voice, and then she's got some really fun, snarky songs too. So
I love that.
it's right in. And reading, I just picked up, I haven't started it yet, but this was a recommendation from someone. It's a book, it's called Rebellious Grief.
Ooh,
Wow.
Yeah.
sounds amazing.
It's a good title.
Yeah, it is. So I'm
Cool.
about to pick that up.
Very cool.
And I'm going to share that with my Death Cafe next month.
Very
Nice.
cool.
Real quick, Kailey, what are you reading?
I am reading a book called What We Can Do When School's Not Working. Oh, I can't really see it. It is kind of a book on how do kids learn and how sometimes typical academic structures may not be, actually aligned with how kids best learn. So it's kind of melting my brain a little bit. Definitely making me think lots of things. All the
Nice.
things.
All the things. Very good.
All the things.
Well, Matt Stratton was on the podcast. He turned me on to Claire Obscure Expedition 33.
Sorry.
Are you playing it? Did you play it?
No, I'm about to. I just had a really good conversation with a client about that.
Get ready for everything, for all the
Really?
grief, get ready for all the pain, get ready for all the head, mind, boggling twists and turns.
You
Like,
guys
it's-
should do an episode
there
on
for
that
it.
once you play.
Well, I tell you what, play it, because we should,
Okay.
because it'll be really
Okay.
good, and we'll have Matt come back. We'll talk about
Oh,
it.
that would be
Oh, I
fun.
love that idea.
Yeah,
Okay.
and then I just did start playing Death Stranding, because Death Stranding 2 just came out, and I hadn't played the first one, so I'm getting the first one. How in the world, and this speaks to the genius of Kojima, the game director, but how a game about carrying boxes and transporting boxes from one location to another could be a fun, exciting game. I have no idea, but he figured it out,
It's
and
brilliant.
it's weird. All right, thanks so much for listening.
All right, my friends.
Thanks for coming, Bethany, and
Thank you so much for having me.
we'll talk more later.
Bye, everyone.
Did heart help me